So today our topic is the hepatitis B virus. Now before starting the topic, we should know about the basic things about the hepatitis B virus, like the family of the hepatitis B virus, whether it is a enveloped or non-enveloped virus, and what is the genome of the virus. So coming to the family of the virus, so this belongs to Hepatnaviridae family, and it is a double-stranded DNA virus, and it is also a enveloped virus. This virus this virus so this is a double stranded DNA virus, and it is the only hepatitis virus which is having DNA, while all other hepatitis viruses like the hepatitis A, C, D, and E, these all hepatitis viruses have single stranded RNA, while this hepatitis B is the only hepatitis virus that has double stranded DNA. So that makes it a unique virus, and this is also a enveloped virus. So the non-enveloped viruses among the hepatitis viruses are the hepatitis A virus and the hepatitis E virus. These two are the non-enveloped viruses, while hepatitis B, C, and D are the enveloped viruses. So this was all about the basic things about the hepatitis B. Now coming to the hepatitis B virus proper, that is, so here first of all we see the viral antigens, the important viral antigens of the hepatitis B virus. So the important antigens which help in the diagnosis are the hepatitis B surface antigen, which is in short written as HBS antigen, hepatitis B core antigen, which is in short written as HBC antigen, and hepatitis B precore antigen, which is in short written as HBE antigen. Okay, so these are the three the important antigens which are helpful in diagnosis of the infection by hepatitis B virus. Now, how does that hepatitis B virus how can this hepatitis B virus can spread? So the mechanism of transmission of this hepatitis B virus are the infected blood transfusion. So this is a blood-borne disease, so it can be transmitted by the blood transfusion with the infected blood, by needle prick injuries, by unprotected sexual intercourse. This may also be the way by which this virus can transmit, and also from mothers to fetus through the placenta. This virus can be transmitted. So these are the four mechanisms or four ways in which this virus can be transmitted. So based on this mechanism of transmission, the most important groups which are at a higher risk to get this infection are the surgeons. Number one is the surgeons. Why? Because they have to perform the surgical procedures on every patient. I mean, uh, whoever is in need, the surgeons have to perform the surgical procedures over them, irrespective of whether the patient is having any hepatitis B or any blood-borne diseases or not. Okay, so the surgeon cannot refuse to perform the surgical procedure on a person suffering from hepatitis B or AIDS. So that's why they are at a higher risk, because any needle prick injuries during the procedure to the doctor, to the surgeon, may lead to the transmission of the blood-borne disease. So the surgeon, the phlebotomists, these are uh, the high risk groups. The other high risk group is the those persons which are those persons who are doing the biomedical waste management, because in biomedical waste, if the biomedical wastes like needles and all are not managed in a manner which is provided by the guidelines. So in that case, there may be injury to the persons who are handling those biomedical waste, and that may lead to the transmission of infection. Other than that, the recipients of blood transfusion, they are also a high risk group for getting these infections. The drug addicts, through as they take the drug dose by the same needle, by the same inject syringe, so there is also again a chance of getting the infection. And also the sex worker, of course, they are also at high risk to develop these infections. Now coming to the outcome of the hepatitis B infections. So outcome is not very strict. Okay, so here, when the hepatitis B infection occurs, then it takes its incubation period, which may vary. Then after the incubation period, there occurs acute hepatitis, and in 90% of cases, this acute hepatitis resolves fully. Okay, so in majority of the cases, this acute hepatitis resolves in 90% of cases, while in 5% of cases, this leads to the chronic hepatitis, and in less than of 5% of cases, it becomes a carrier. Now as it becomes the now as it becomes this as it becomes the as it gets the turned up into chronic hepatitis, then 2% of cases of those chronic hepatitis may again go to recovery phase. Okay, so of those chronic hepatitis uh, patients, 2% of them may have the chance to go to recovery stage, and while out of them, the 30% become again they become the carrier, they may become the carrier. And the majority of the patients with chronic hepatitis due to hepatitis B, like 70% of those patients with chronic hepatitis due to hepatitis B, they land up into getting the cirrhosis. So that is the final stage after the chronic hepatitis. So maximum patients, about 70% of the patients who are having the chronic hepatitis due to hepatitis B, they'll end up into cirrhosis. And now from the cirrhosis, they may develop the hepatocellular carcinoma or the liver failure. These are the dangerous outcomes of the hepatitis B infection. But see here, maximum get recovered. About 90% of the patients get the recovery. Now the coming to the most important part of this video, that is the laboratory diagnosis, that is many of the times asked in the university exams. So the laboratory diagnosis can be written in a very easy and a very short manner to cover all the points and to get the maximum marks in the university exams. So let's see the laboratory diagnosis. So as we have learned the viral antigens, those antigens will be helping us to get diagnose the hepatitis B infection. So coming to the first antigen, that is the hepatitis B surface antigen, HBS antigen. Why it is important? It is important because it is the first antigen to be elevated. And what does this, if this hepatitis B surface antigen comes out to be reactive, that means if it is positive, then it indicates that the infection has been initiated. And and uh, throughout the acute hepatitis phase, we have seen that after the infection, after the incubation period, there occurs acute hepatitis phase. So throughout that acute hepatitis phase, this HBs antigen level remains elevated. This HBs antigen level remains elevated. Now coming to the hepatitis B pre-core antigen, that is the second antigen that we can focus on to diagnose the hepatitis B infection. So hepatitis B pre-core antigen that appears shortly after the appearance of hepatitis B surface antigen in the serum. So as the hepatitis B surface antigen appears after the appearance of the hepatitis B surface antigen, this hepatitis B precore antigen appears. And what does it indicate? It indicates the active viral replication. It indicates active viral replication and a high level of HBs antigen. A high level of HBs antigen indicates high infectivity. So this is sometimes asked in MCQs as well, like which of the antigens indicates the active viral replication or high infectivity. So remember, it is the HBe antigen which indicates high infectivity, infectivity and active viral replication. So this MCQs are sometimes asked. Also, this the important one more important point about this HBe antigen is that it remains elevated throughout the acute, chronic, and as well as the carrier stages. So we cannot differentiate, mark the words, we cannot differentiate between the acute, chronic, or carrier stages with the help of this HBe antigen. So these stages cannot be differentiated by the HBe antigen, but we can say on the basis of HBs antigen that it is a acute hepatitis stage. But with the hepatitis E antigen, precore antigen, it is not the case. We with this antigen we cannot say that whether it is a acute, chronic, or a carrier stage. With the help of HBs antigen, the surface antigen, we can say that it is a acute stage. Remember the points. Coming to the next antigen, that is the hepatitis B core antigen, otherwise known as HBC antigen. So this is also known as the hidden antigen. Okay, remember this point. This is also known as the hidden antigen. Why is that so? This is because it does not appear in the blood. It does not appear in the blood because it is not a secretory antigen. This HBC antigen is not a secretory antigen. So how can we detect this HBC antigen? So for detecting the HBC antigen, sorry, it is HBC antigen. So how can we detect this HBC antigen? So for detecting the HBC antigen, we have to perform the immunofluorescent test, because these antigens are present within the hepatocytes. They do not get secreted into the blood. So for detecting the HBC antigen, we have to take the section of the liver and in the hepatocytes. With the help of the immunofluorescent test, we can demonstrate the HBC antigen. So that is not a antigen which is helping us in diagnosis. We do not go for HBC antigen for diagnosis of hepatitis B. That is for just for the sake of the knowledge I have included in the diagnosis of the hepatitis B infection. Next is the anti-HBC IgM antibody. Now coming to the antibodies. So the first antibody to be elevated in the hepatitis B infection is the HBC IgM antibody. Remember, the first antigen to be elevated was HB surface antigen, HBs antigen, but the first antibody to be elevated is the HBC IgM antibody, HBC IgM antibody, and this antibody appears after appearance of the HBs antigen, and this indicates acute HBV infection. Okay, just like the HBs antigen, it also indicates the acute HBV infection, hepatitis B infection. Then next is the anti-HBC IgG antibody. So just we saw the anti-HBC IgM antibody. Now this is the IgG antibody, and that we know that IgG is a antibody of chronic stage, while the IgM is the antibody of acute stage. So by the type of antibody, we can say that this IgG antibody will be seen in the chronic stage. Okay, in the chronic stage. So see here, if the HBC IgG antibody is raised, plus there is HBs antigen, plus there is increase in the liver enzymes, then we can infer that it is a chronic stage. It is a chronic stage. While if the IgG antibody is elevated, plus there is HBs antigen, but there is no symptoms, then we can infer that it is the carrier stage. This is sometimes asked in the MCQs, so please remember these combinations. Okay, now coming to the graph. So before the graph, let's see the other antibodies in the diagnosis. We'll see the graph at the last. So the next antibody that we can detect is the anti-HBe antibody that appears after clearance of HBe antigen, and anti-HBs antibody that appear after clearance of HBs antigen. So of course this antibody of HBs will appear after the disappearance of HBs antigen, that is for sure, according to the concepts of the immunology. Now coming to what does this HBs antibody indicate? So this indicates either recovery or immunity. Remember, this is the only antibody that we see after the hepatitis B vaccination. So once the hepatitis B vaccination is done, then only this anti-HBs antibody is seen. So this indicates either recovery or immunity due to the hepatitis B infection. Now coming to the graph. Remember, in every questions of university exams, try to make graphs, diagrams, and anything diagrammatic, uh, which is diagrammatically which is possible, you can draw to fetch the good marks, to fetch better marks than others. So for getting good marks, so you have to draw the diagrams, graphs, flow charts, and remember you have to do these all. So making a graph will be a very good thing for getting good marks. So let's understand the graph here. So here we have put the antigens along the y-axis and the time in months in x-axis. Now let's see, we have learned earlier that HBs antigen is the first antigen to be elevated. Remember, we have learned it. So in within 1 month, within 1 month time period, this HBs antigen start appearing, and after the HBs antigen, what appears? So after HBs antigen, HBe appears. See here, HBe appears after the appearance of HBs antigen. So HBe appears after HBs, but remember, HBc antigen never appears in the blood, because that is a hidden antigen that remains inside the hepatocytes. That is a non-secretory antigen. Okay, so that's why HBc antigen, core antigen, never appears in the blood. So we will talk about these two antigens only. First appears the HBs antigen, then appears the HBe antigen, and then see, the first antibody to be elevated is anti-HBc antibody. See here that this antibody is elevated here at 2 months. At 2 months of time after getting the infection, this antibody is rising. This antibody is rising here. This antibody is rising like that. Okay, and then how does this anti-HBs antibody and anti-HBe antibody appear? So see here, once the HBs antigen fall down here, the HBs antigen, the HBs antibody uprise occurs. While when the HBe antigen fall occurs at around 5th month, then the rise of anti-HBe antibody occurs. So once the HBe antigen falls, then anti-HBe antibody rises, and once the HBs antigen falls, then here, once the once the HBs antigen falls here, then this anti-HBs antibody rises. So this is a very, so this is a, sorry, so this is a very important graph. This graph should must be made whenever the diagnosis of hepatitis B infection is asked in the university exams for fetching good marks. Okay, so this is all about the hepatitis B virus. What is asked in the exams is a clinical scenario will be given, and after that the laboratory diagnosis will be asked, the mode of transmissions may be asked. So these are all the questions which will be asked from which will be asked from this hepatitis B virus topic. So for this topic, this is all I have to say. Okay.